Happy Thursday, everyone. Happy Thursday. Welcome to I Do Not Have a Podcast. Sanfrey, I don't have a podcast. But if I did, today I would be talking to Sanfrey Purdy Porter about Expressed with Care lactation services. I am so excited about this conversation. I could not, in season one, I guess, of this not podcast, without having a conversation about breastfeeding. I breastfed two babies, and I really want to get all into the nitty gritty behind the breastfeeding of babies and nurturing of babies. So, how are you?
I'm good. Busy with life, but I'm good.
Of course. A little birdie told me that you have some free time lately.
Yeah. I've been outside.
You've been outside just a little bit.
Just a little bit. The kids are away with their grandparents, so me and my husband are kind of enjoying this free time.
That's always a good thing, right? That's always a good thing. Look, we don't say it often because mamas and dads, we're gonna just do what we have to do. But sometimes it's good to take a breather from the kids and just be outside or inside or wherever you desire to be. Sometimes it's good to just rest and relax and have time away from the kids, right?
Yes. We missed them, but we're enjoying this time.
Yes, you always miss, and it's such a contradictory type thing because you miss them, you don't want them gone, you don't want anybody to babysit them, but it's but I need my time, right?
Yeah,
exactly. It's always such a catch-22. So if you're coming in from on Instagram or wherever you're viewing us from, if you're catching the replay, make sure that you hit like, comment, share. That's a free way to support this channel and to keep the content going while we get into this with Sanfrey. So Sanfrey, tell me, so I know you from the running world. I think I met you maybe 10 years ago, 8 years ago. I met you a long time ago from Black Girls Run in Charlotte. And you've been an amazing inspiration to me just in regards to your running career. And so I kind of have had a internet view of your journey. And I know that you work as a physical therapist, I think. Yeah. And so how did you find the path? So how did you find the path from working as a physical therapist and now a lactation consultant? How do you find that path?
So I've always, physical therapy is my first love. I've been doing it almost 20 years. But when I decided to have kids, I always thought, okay, I wanted to breastfeed. So when I had my first child, who's almost 18, I went into it thinking it was going to be easy, but it wasn't. I got 2 weeks into it. I was really stressed out. I went to seek lactation support. And at that time they were like, well, it's not working for you. Just go ahead and do formula. This was the lactation consultant.
That was so the first time they met you?
Yes. Wow. And so for me, it was a relief because I was like, okay, well, maybe I should take this easy out because I was just stressed and not sleeping and everything. But in the back of my mind, I felt like I gave up too easily. Then when I fast forward, when I had my next child, I was like, okay, I'm going to get this right. I had a little bit more education and knowledge about breastfeeding. I joined a Black breastfeeding group on Facebook to kind of find out a little bit more about breastfeeding. I said, okay, I'm going to do it this time. And my pregnancy went great. I was healthy most of my pregnancy. Then I have him and everything goes out of whack. I ended up having a syndrome called the HELP syndrome, which is a very bad form of preeclampsia, which put me and him in danger, which I wasn't aware of until the day he was born. So he was born full term, but low birth weight, came out. They swept him away to NICU because he kept having low blood sugars and jaundice. And then I ended up having issues from the epidural and had to stay some extra days because my platelets were really low. And so the breastfeeding journey didn't start off how I hoped, but I still kind of persevered, pushed through. But he still continued to have some health issues throughout his first year of life. So even though I wanted to exclusively breastfeed, I ended up having to kind of supplement him with formula, but we were able to do that off and on for 8 months. So I was proud of that journey because it could have ended earlier than it should have. Mm-hmm. And then few years after that, I thought I was done having babies. And then we ended up getting this little surprise. And it turned out
to be a beautiful little surprise.
Yeah, my beautiful little baby girl. And so I was like, okay, I'm going to do this. We're finally going to get this down. And I wanted to have, so I was fortunate enough with my second child to have a VBAC, which is a vaginal birth after C-section. And I wanted to try to do the same thing with her, but I wasn't able to because I had some complications. But it kind of fueled my drive to make sure that breastfeeding went right for me this time. And so she was a champ with breastfeeding, and I was able to exclusively breastfeed her for a full year. And then we continued to breastfeed until she was almost 3 years old. Wow. But during that time, I just got really intrigued with breastfeeding and the science of it because I'm kind of a nerd at heart. So when I saw that there was an opportunity at the Johnson C. Smith University for a lactation program, I kind of jumped on it, went to an information session, and I was like, okay, I'm gonna apply for this because I'm really interested. And so I applied, I got in. It was supposed to be kind of a 2-year program, but it got really condensed because of COVID. And so COVID made things really interesting with trying to get all of my clinical hours and things like that. But I pushed through. I was working full time as a PT. I was trying to homeschool, trying to do the classes virtually for lactation and doing clinical hours for lactation.
Oh my God, you were doing a lot, doing the most.
I don't even remember what happened that whole time. It was such a blur. But we got through it, thankfully, for my parents and my husband being very supportive. Was able to get through all of that and pass. You do have to take a certification exam to become an international board certified lactation consultant. So after I finished the courses, I studied long and hard for that and then became certified. So really my drive to become a lactation consultant was really due to my breastfeeding journey with my kids and just wanting to support people who look like me that didn't get the support that they needed in order to be successful with their breastfeeding journeys, whatever that might look like.
Yeah, I love that. And I love that because you said women that look like you. Or so I looked it up, and what I found, it was interesting because I thought that we all breastfeed. But what I came to find out via Google is that Black women actually are the lowest percentage of women, mothers, that choose to breastfeed. Why do you think that is?
So there is such a very nuanced answer to that question. A lot of it is very deeply rooted in our history, especially here in America, going back, because we were born and destined to breastfeed our children, because just like cows breastfeed their babies, that all mammals have the capability of breastfeeding. So when slavery came about, we had the slave women working as wet nurses for their masters, and foregoing the nutrition and health of their own babies to support the health of their master's babies. And it just became, they weren't able to nourish their own babies. A lot of their children died because of that. Then there was another shift when we were kind of forced to be more in the workforce. And formula was being pushed very heavily as being the convenient way to feed our babies. And especially if you're a working woman, working outside of the home where you don't always have time, or it doesn't seem like you have enough time to breastfeed your babies. So formula became kind of like that easy way out. And I'm not saying it's an easy way out, because we want you to be able to feed your babies however it is necessary to feed your babies, but we also want to support those who want to breastfeed as well. So there was a big push by the pet company that they adopted these 4 sisters. They were quadruplets called the Fultz sisters. If you don't know their story, it's a very interesting story. And they were Black, and they came from a very poor family, and they kind of became the face of pet milk and pet formula. So I think seeing their faces also kind of pushed that drive for more Black women and Black families to go lean more towards formula feeding versus breastfeeding. Plus, kind of like the sexual stigma attached to breastfeeding, with Black women being hypersexualized, and it's just a very nuanced question.
Yeah.
I can
I
go
remember
very
when,
into.
to your point, with my first, who's about to be 14, I breastfed maybe shy of 6 months. And then I was trying to breastfeed at work, and I couldn't do it. I had my own office, but in between, I'm a therapist, and so I couldn't wing it because of the therapy sessions, and so my breast milk dried up. And so I hear you when you say that sometimes working women just can't. And then with the second, I tried to breastfeed as well. Her dad would also be here, and so he would. I had to express the milk, and he would feed the baby, but. And so that I was able to do it longer because of that, but it's still hard. It is really hard. How do you support a woman that desires to breastfeed, but has all of these obstacles that you were talking about?
And that's the big thing. Like, that is kind of the number one reason why people who want to breastfeed end up stopping their journey so early, because they don't have support. So really, if I can get someone else in their life involved in this journey with them that is going to support them, that is the best thing. But also, I've been just very blessed to be a part of an organization called Chocolate Milk Cafe, where we provide peer support to Black families who desire to feed their baby human milk. And while there are other breastfeeding support groups out there like La Leche League, which is a great organization, but you don't often see people that look like us. Yeah. So, and oftentimes we feel like, well, maybe this is not something that Black people do. They don't breastfeed because we work so much. So support, and really I have a big heart for the work outside of the home mom, because I am a work outside of the home mom, and I had to go through this journey myself. So just being kind of like that sounding board and being available to answer any questions people might have, especially when it comes to going back to work, because every parent has anxiety about leaving their baby. And then when you're breastfeeding, that's a whole nother thing, because you're worried about, okay, if the person that's watching them is going to feed them just how you want them to feed them.
Because it makes a difference. Yeah. Like, you can pump like if your baby, and you can go into more details because I am not an expert, but what I do know from my experience is that you can know that your baby takes 4 ounces every hour, every 2 hours or whatever, and you pump that amount, and the person can feed them more than they're supposed to get, and then your baby's like not having milk. So how does that all work? Like, how do you support? Like, how does the partner, whoever's in the journey with them, learn what they need to learn, or what do they need to know in order to make it a successful journey?
I mean, I know from my personal experience, like my husband was very supportive, as far as, when I learned the proper way to bottle feed my baby, when I went back to work, to where she wasn't taking in too much volume. I basically taught everybody who I knew that was going to be taking care of her, this is how you feed her so she does not get overfed, because I only got so much milk that I produce in a day, but it should be enough to satisfy her. I taught my husband, I taught my oldest son, who at the time was 11 years old, how to do it. I taught my mom. I taught the lady who kept her. And I was very fortunate to find a daycare provider who was very open to learning
that's so good.
how it all worked. And that
Mhm.
was a big thing, having the village that supported what I was trying to do, because they knew I was determined to do it.
I was gonna say, like, you really have to be determined that this is the journey that I'm taking, and I'm going to make everything happen in my power to make this journey successful. Because
Mm-hmm.
there's a measure of having to advocate for yourself, is what I think I hear you saying.
Mm-hmm.
Yeah.
Exactly.
So, what is the proper way? You said that you had to teach them the proper way. Can you share some about the proper way to feed the baby? And I also hear
Mm-hmm.
things about chest fed versus breastfed. Is there a difference?
There is a difference in how a person may want to be adjusted. Like, usually we use chest fed more so geared toward the LGBTQIA family, because everybody doesn't identify with calling their chest breast. So that's
Ah,
where that comes in, because we want to make sure this is inclusive, for everyone who wants it. And I use breastfed, chest fed interchangeably, and it's not to exclude anyone. I just, but that's where that comes from.
got it. All right. So, what is the proper way to breastfeed or chest feed the baby? Can you share some
So
about that?
So usually, when babies nurse at the breast, the flow is usually slower. So usually they have to work to get your let down going, and then that milk starts to flow. So knowing how to properly bottle feed to mimic that is the goal. So because the babies are controlling that rate once they start suckling, so we want them to learn how to control it at the bottle. So there's
Mhm.
a certain way you can hold the bottle, position the bottle in order to encourage the slower flow, and position the baby in order to encourage a slower flow, so that they get what they need, but they don't get overfed, and that they're satisfied with the amount that they are given. And this is called paced bottle feeding.
I never heard of that. And I
Mm-hmm.
had a lactation consultant, and they never said that to me. So, wow. Wow.
Mm-hmm.
And you mentioned something that was really interesting in regards to what I think when I first, with my first, I kind of expected my milk to come in. That's what they call it. I think I
Mm-hmm.
expected my milk to come in like right away, but it didn't. And so
Mm-hmm.
I got discouraged right off the bat.
Mm-hmm. So, people have to understand that, um, breastfeeding, milk production is very hormonally driven. So
Mm,
while you're pregnant, your body, is protecting your baby. So those hormones are not all the way activated yet until after you have the baby. Now you might see colostrum. A lot of people might see the clear, kind of first milk that comes in while you're pregnant. But the full milk doesn't come in until after you've had the baby, placenta is removed, you start putting your baby to skin, and baby starts suckling. Um, the more you put the baby to the breast, or the more the breasts are stimulated via either pumping or direct breastfeeding, this causes that milk to start to flow.
mhm,
However, a lot of things can happen that can impede that. Sometimes a lot of the medical interventions that we have can, kind of slow that production from happening, like epidurals, if you have to be separated for your baby from any period of time. Um, just a lot of things can happen that might delay that milk, or if you have like gestational diabetes or anything like that. So sometimes if you know those things might occur, you can kind of prepare early on, so that, um, if you are harvesting some of your colostrum while you're, pregnant, you can kind of harvest that and save that for later. So the baby has something while you're trying to get your milk production going.
mhm.
Or, a lot of parents may start pumping right after birth in order to kind of jumpstart that stimulation, especially like if you have a baby that has been sent to the NICU, and you might have to start pumping early.
Yeah. I work with some parents that co-parent, and so they share the baby has two homes, and so baby is away from mom like right away. And so what I think I hear you saying is that for moms that would love to breastfeed or chest feed, their journey hasn't ended or is not just totally destroyed because of the co-parenting dynamic. They can choose to
Mm-hmm.
also pump when the baby's away. And that is very similar to
Mm-hmm.
having the baby there.
It's similar, but I know having your baby there helps with the hormone oxytocin,
Mm-hmm.
which is kind of like that milk letdown hormone that it gives you all the feels when you're seeing the baby and the cuddling. But a way to kind of combat that lack of having that baby there is maybe having pictures of the baby while you're pumping or listening to a song that your baby enjoys while you're pumping, things that give you kind of all those feels to kind of help that oxytocin start allowing that milk to flow.
Those are some really good tips. Like even the baby's smelling the baby's blanket or
Mm-hmm.
whatever they have there. That is a really good tip, Sanpri. That's really good. Yeah. And so it's not, I love that. I love that because sometimes co-parenting moms really feel disappointed in their journey because they didn't get the opportunity to have the baby there. What are the benefits to the baby and then to the mom of for breastfeeding?
So
Specifically,
there
let's
are
start with the baby and then let's talk about the mom.
so of course there are some developmental benefits for babies. One, the immunity benefit for babies is very beneficial. And people think that immunity benefit decreases over time, but really your milk kind of becomes more concentrated as the baby gets older. So the longer you nurse breastfeed, the more benefits to that baby's immune system or that toddler's immune system that
Wow.
occurs.
It's so
Um,
controversial. Like it is so like I heard you say that you breastfed until your baby was 3. Did you say
yeah,
3?
she was almost like 1 month shy of 3.
Did you get looks from people?
Not really. I mean, if I did, I didn't really pay attention.
Right.
And and I never planned on nursing her that long. It
Mhm.
was just because COVID happened and I was like, well, I might as well keep nursing to kind of protect her. Now the weird thing is she ended up getting COVID. The only one in the house that got COVID, but she recovered like really quickly. Like she was only
Wow.
down for like a day and she was
Wow.
good. So
Wow.
those are some very big benefits. Also just the attachment. And not to say anybody that formula feeds doesn't feel that same attachment, but just that bonding, that constant skin to skin, it helps to regulate the baby's temperature. It helps to regulate their blood sugars when they're born. Um, when for moms, it helps shrink your uterus quicker. It also helps as far as kind of lowering your risk for breast cancer um, and other reproductive cancers as well.
Oh, I didn't know that. I didn't know
And it
that.
can contribute to helping with bouncing back a little bit from postpartum depression.
I wanted to go
For
into that.
for
Yes.
some, yeah,
Yeah.
for me, because I did have postpartum depression with my daughter, and I think that being able to successfully breastfeed her helped contribute to improving that postpartum depression. And I had anxiety as well.
Wow. Wow. And sometimes dads kind of feel like they're missing out on the experience. And so, like I said earlier, that especially my daughter's dad, he would he would, give her the bottle, right? And I
Mm-hmm.
kind of feel like he kind of got to participate because he gave her the bottle. Are there other ways or strategies that you talk to with the dad to make sure they are integral in the journey
I
and not
mean,
feel left
there,
out?
oh, definitely. Like there's so much more. many things you can do besides feed the baby. I mean, dads can get skin to skin too.
Yes.
I encourage them, lay that baby on your chest,
Mm-hmm.
get all those sweet cuddles. They can baby wear, they can wear the little harness and the little
Mm-hmm.
wraps to keep that baby close. They can do the nighttime baths, the reading. They can sit there with mom while she's breastfeeding. Don't have mom sitting up there by herself at night. Keep her company, give her some snacks. Y'all sit and watch Netflix, because a lot of times people don't know, when you're nursing, the oxytocin release also makes you sleepy.
Yeah.
So sometimes there have been incidences where people will be holding their baby nursing, and baby kind of might roll off, roll off down the floor. So you need somebody to be there to be like, hey, you're falling asleep, wake up, or let's go lay down, or let me take the baby for you, or something like that, because it's just a safety thing for mom and baby too.
That's good. That's really, really good. I love it. So what's the hardest kind of case that you have had, and what's the most rewarding case that you've had or worked with?
I think when I first, because I was at one time I was working maternity at one of the local hospitals, and I think this was right early on when I first started working there, and I had a parent who had a stillborn baby, and she wanted to suppress her milk, which understandably so, and
What does that
just
mean,
going.
suppress? Like
So she
not
wanted
let
to
it.
stop
Okay.
it from
Mm-hmm.
coming because of the trauma that she went through losing her full-term baby.
Mm-hmm.
Trigger warning, I'm sorry. But that was very hard, because people don't realize that we also, lactation consultants, can also support parents in this journey as well. And some parents decide they want to continue to pump milk and do donor milk even if their baby has passed. But this particular mom wanted to suppress hers. So I remember going in there with another lactation consultant, because this is my first time dealing with that situation.
Mm-hmm.
And they were just a really sweet couple, and the baby was there.
Mm.
And so just talking her through that, it was just a very sensitive time. I felt honored that she allowed us to be in her space, because I know that was hard. And she was just so gracious about getting that help. So that was the hardest thing I've had to do.
You bring up a really good point, because this is like having a lactation, like this is a very intimate space that you're supporting between a mom and a baby, or mom, baby, and a father, or mom, between mom and the parents, right?
Mm-hmm.
Um, it's such an intimate space. And sometimes you have to be really vulnerable to what's happening with them, past trauma, even. And,
Mm-hmm.
I'm a therapist. So let's talk a little bit about moms who may have had previous sexual abuse,
Mm-hmm.
and that may come up in their breastfeeding journey. How do you support them as a lactation consultant?
I haven't had it often, but I just, being in the hospital setting in particular, usually when I'm looking at the chart, there's something flagged that they might have had something like that occur. So I go in, and my goal is to be empathetic, but
Mm-hmm.
also I just want to just listen to what they want. So I
Yeah.
don't go in there saying, this is what we're going to do. You got to get the baby on the breast. Da, da, da. I just ask them, what are their goals? What do they want to achieve as far as providing milk for their baby? What do they want that to look like?
Mm-hmm.
And I just listen, and I let them tell me.
Yeah.
I'm a big proponent, and this is not just with my lactation patients, but with my physical therapy patients. I'm a very big proponent of reading the room. So
Absolutely.
when I go in there and I see mom looking stressed out, or dad or partner looking stressed out, there's maybe grandparents in there, babies crying, there's bottles and pump parts everywhere. I just want to go in there and kind of calm some of that chaos. And I want to
Yeah.
kind of center the dyad, which is the dyad includes the nursing parent and the baby, and I want to center them and kind of focus on their needs at that point.
Yeah.
And I've had parents tell me, I just want to pump, because they had an aversion to direct nursing. And I talked them through that and how that journey will look. And I want them to know this is what it's going to take to exclusively pump. And, we just kind of just go from there and just talk about their goals.
That's good. So but you leave it all up to them. So it really is an individualized approach. Yeah. Yeah, that's good. And what's been the most rewarding patient client case that you've experienced or know of?
Oh, goodness. Wow. It's a lot. I think one, helping a friend of mine with her breastfeeding journey. We were coworkers, helping her through it because she wanted to stop early. And just helping her through it and realize, like, you can do this, you can do this. Or seeing like my NICU moms, kind of persevere through that, because being separated from your baby, the couple of weeks I was separated from my baby was hard. So just imagine having to do that for weeks on end for your baby, and just supporting them through that journey, because pumping around the clock is hard.
Is that what they have to do? Like when the baby's in NICU, pump around, like always pumping?
Yeah, typically, because usually they have to pump and then they have to bring the milk to the hospital. And then a lot of times some of those parents will be there all day with their baby, or they might have to go back to work even though baby's still in the hospital. So being able to support them with that journey.
Wow. That's so good. So so we talked a lot about, breastfeeding or chest feeding. What about if a parent does decide to incorporate formula, all or nothing? Like, what are the things to consider? Well, let me ask you this before we go there. How do you know if breastfeeding is right for you or not right for you?
I mean, that is a very individual question. I'm always a proponent of just, give it a try if you can. I mean, and that's whether you try it for 1 week or you try it for 3 months. I mean, you tried, and you, for those few days or however, you gave your baby the best of yourself. So you should be proud of it, and you shouldn't be ashamed if you do need to stop, because you are doing what's best for you and your child. I'm very big also on mental health as well. So, if I recently had a client who had twins, and she was just going through it mentally, and I told her, I'm going to tell you the things you can do, but at the end of the day, you need to be okay. So if doing all of this is going to make you not okay, then you have the right to stop and
You have
switch
the right to stop and not feel, because we do as moms feel like not only are we disappointed, but we feel guilty and ashamed. Something is wrong with me. I couldn't feed my baby. Like I heard you say earlier, all mammals were given the supplies to do this. Why couldn't I? Right? Can you talk to that mom that might have either tried or is trying and is having a really difficult time and is contemplating, is this the right path for her? And maybe feeling that guilt, that shame, all of those things, the disappointment. Can you talk to that mom?
And I really hope for that parent, that mom, has a good support system, first of all, in play. And, I always want her to realize, her providing love and taking care of her baby, taking care of herself is the best thing she can do for her child. We got to take care of ourselves so we can pour into our children. So if you are breastfeeding and you realize, hey, this it's not right for me, or I can't do this all the time, you know, shift gears. But also try to use your resources. So if you're able to get a lactation consultant, you know, we not only are at the hospitals and clinics, but we can come to you, you know. So if you're able to get some professional help to maybe see if you've exhausted all of the avenues, you know, first, you know, if you can do that, try that. But if it's still not working for you, it's okay. You've given that the good old college try, but you got to be okay. You got to be okay for your baby.
That's good. That's good. Considerations for integrating or implementing formula into the breastfeeding. Because I heard this saying when I was breastfeeding, and it sometimes sticks with me, and it says that fed baby is best.
Mm-hmm.
Are you familiar with that saying?
Yeah.
You know, fed is like, there's this thing, breastfeeding is the best, right? And then there's another line of thinking that a fed baby is best. Can you kind of just explain what that means?
So that's a very
You laugh.
nuanced,
Ashley
and it's
laughs about the
very
comment. Yeah.
controversial because a lot of people have this this feeling that the fed is best has been pushed a lot by people who are more uh supporters of formula and formula companies.
Mm-hmm.
You know, but fed is definitely, we want baby to be fed, but we
Definitely.
also want to look at where the information is coming from as well, because a lot of times it kind of pushed people to kind of gear more towards formula and not really attempt to breastfeed or seek help when it comes to breastfeeding. So while I don't want to I don't want to say what is right or wrong with that statement, but I just want to say consider the source from where it comes from.
Yeah, that's good. That's good in light of what you shared earlier about, like, you went to the one lactation specialist and the first thing she said was, okay, let's get some formula. Like, she didn't even try to help you. Are you there?
Mm-hmm.
Yeah, I was just
Yeah,
saying that
yeah.
that was I like your
And
comeback about that, because that first person that you went to didn't even try to help you. They
I'm
just
here.
gave you formula.
Can you hear me?
I can hear you.
Oh,
Are you there?
yeah.
Okay. All right.
I'm here. Can you hear
I
me?
can hear you fine.
Okay.
Yeah.
What was the question? Did you ask me a question? I'm
No,
sorry. I don't know.
I was just saying that, I was just remarking that, you talked about that first lactation specialist that you went to, who didn't try to help you at all. She just kind of gave you the formula and didn't even try.
Mm-hmm.
What you're saying in regards to that saying that I heard when I was breastfeeding, that fed baby is best, you have to consider the source, because some people don't really support breastfeeding, or maybe
Mm-hmm.
they are tired of trying to convince moms to do it. Like, do what
Mm-hmm.
you want to do, lady.
Yeah.
Yeah.
Exactly.
Yeah. So in regards to kind of supplementing with formula, how do we know when it's time? You kind of alluded to this, but kind of be more specific about, how do we know when it's time and how do we do that?
There's several ways you can incorporate formula. I guess it's parent specific. It's just all depending on what your goals are. Like, I've had some people say, well, I want to nurse during the day, but I want to formula feed at night.
Mm.
Or I want to, I want to provide a mix of breast milk and formula, or, so there are many different ways people can decide they want to supplement. I always tell them the caveat is sometimes if your milk supply isn't well established, when you do start supplementing, it might impact your supply, because that's less stimulation to your breast, less, unless you are pumping whenever you are supplementing. But if you do decide that, it could impact your supply. It doesn't for
Can you
everybody, but it
can you
can.
restart your supply at any time? Like even if you don't have a baby, like I've heard like weird, like just things that feel weird to me that like grandmothers or are breastfeeding their grandchildren. Like, is that actually possible?
Yeah, you can there's relactation and you can induce lactation. So you people who have never had a baby can induce lactation, like those people that might want to adopt, or like if there's like a same-sex couple and they might want the one that's not carrying the baby wants to do the breastfeeding or chest feeding, they can do induced lactation. Or you can relactate, meaning like maybe you haven't breastfed in a while, you stop because for whatever reason you had to stop, but then later on you decide, well, maybe I want to breastfeed, so I want to know how to bring my supply back up. So really, in most cases, it's a matter of just going back to stimulating your breasts, and it might in regards to you might have to start pumping kind of around the clock like you heard before to kind of get that milk started again. And same thing with induced lactation, it might be a little different because it might also involve medications to help with that. um, but it is definitely possible for people who've never had a baby to produce milk. It may not be a full supply, but for some people, but it is possible.
Our bodies are amazing. Our
Mm-hmm.
bodies are really amazing. Wow. So you're a certified lactation consultant. Tell us a little bit about the services that you offer at your business. I'm so proud of you. Expressed with Care Lactation Services. Kind of tell us about, what you do, how you do
Mm-hmm.
it, and how you support us in our community.
Okay. So I birthed Express with Care out of sheer kind of fear, but I was like, I'm going to do it anyway. Um, but basically, I can provide in home support for parents who are going through their lactation journey. Right now, since I'm also still working as a physical therapist full time, I really kind of focus on after hours support. So like if I have time after work to go see a parent, I certainly don't mind going seeing the parents like at 6 in the evening, because usually that's when the babies start acting up. Then
Mm-hmm.
that witching hour,
Mm-hmm.
where parents are going crazy because baby is crying and they don't know what's wrong. And I can do weekend support as well. I really have a heart for, like I said, work outside of the home parents, so I can provide support for going back to work. Um, I can do education classes, like if you desire to have some prenatal support, we can do a prenatal course to kind of prepare you for breastfeeding. We can do something postpartum. Um, just helping with all kinds of the little challenges you might face, where making sure that you have the right support, like if your baby has a tongue tie and baby's not latching well, just making sure I connect you with the right resources for that as well.
Yeah. I do want to just, are there any other services that you offer?
Basically, I also can offer like education on picking pumps, making sure you're picking the right pump for you. I also have a course that I developed for caregivers, so like
Mm.
daycare providers who want to know the kind of the ins and outs of supporting parents who breastfeed,
Mhm.
because there's a lot of kind of stigma around taking care of breastfed babies, because it's not different, but it is. um, and then there's laws that support people breastfeeding, so we want to make sure that caregivers are aware of that. So just
What
different.
are the laws that impact breastfeeding moms?
So you definitely, depending on the size of the company, you should be allowed to breastfeed and pump up to at least a year for your baby. I can't remember the specific name of the law, and I'll probably have to go dig a little bit. Um, but you should have a clean place to pump that's not a bathroom. So your employer should be able to provide you for a safe area to pump. Um, there, and you shouldn't be discriminated against if you are a breastfeeding or nursing parent when you go back to work. And
Absolutely.
you should be allotted that time.
So I missed what you said about the time frame that you are legally supposed to have at work.
You should have at least up to a year to be able to pump at work. You should have a designated time that does not include like your break time, so you don't get penalized for when you
That's good.
go pump.
Are these recent law changes?
No, these laws have been around. It's just there are caveats to it because there are a lot of people that have professions where it makes it difficult even with the laws in place. So like say nurses,
Yeah, fast food
that
workers.
fast food
Like
workers.
public facing
Yeah.
employees. Mm-hmm.
And so I am realistic in that I know that you might not, even though the law is there, you still, just based on what the work you do, you might not be able to do that. So just coming up with creative ways in order for you to be able to provide milk for your baby when you're away at work.
Mm-hmm.
Because in a perfect world, yes, we would all be able to sit down for 30 minutes and pump, but it's not realistic for some professions.
And ideally, it's pumping every 2 hours, right?
Yeah, every 2 to 3 hours. Usually my rule of thumb is kind of go based on the feeding pattern of your baby. So
Mm-hmm.
for most people is every 2 to 3 hours.
Yeah. Oh, and I wanted to ask before we end, we talk a lot about the mom, but then you mentioned like baby having a tongue tie, and it made me think about some of the challenges that babies have with latching and with breastfeeding. Can you just kind of talk a little bit about some of the things that babies may experience when it comes to the breastfeeding journey and how to support the baby?
So a lot of times when babies might have a difficult time latching, the first thing I always look at is positioning. So making sure that the baby is positioned well, that the mom is in a good position where she's not like humped over, poor posture. She's making sure she's positioned where the baby is up high so that she has her breast supported and she's supporting the baby, and there's just optimal hand positioning to make sure that the baby is able to open wide enough to latch on the breast without hurting the mom. Now sometimes for whatever reason the baby may have an oral restriction, or what most people know as a tongue tie, or it can also be there's a big word for that, but we'll just go with tongue tie.
It's late right now. It's late on a Thursday.
So a lot of times it can be kind of we're not able, as lactation consultants, I can't diagnose a tongue tie, but I can kind of observe and look at the symptoms of one. So like depending on where, because that, underneath your tongue, there's a little band of tissue, and depending on the positioning of that tissue, I can kind of look and see what's going on that could be causing issues with breastfeeding. And a lot of times if the mom is having pain, that is a big indicator that there may be something either going on with the positioning, or it could be something orally going on with the baby where the baby's not able to open up and latch well. So, and I try to give that, when I was working in maternity, I would try to give kind of prepare parents for that if I suspected it, because a lot of times parents aren't given this information. They go home and baby's not latching, baby's not gaining weight because they're not moving milk well because of that tongue tie. So their weight is slow to pick up, and they're thinking there's something wrong with them. So when it might be a matter of something going on that just needs to be corrected, if possible, with the baby.
That's so good. This is so valuable. It's some valuable information. I love what you do. I love that you have a heart for our community. I love that you have a heart for working moms, because we need it. We absolutely need it. So thank you so much for sharing your wealth of knowledge with us. Tell us where we can find you if someone is listening and they want to book a session with you. How do we find you?
Yeah, so I have a website. It's expresswithcare LLC.com. It's kind of under construction now, but you can also email me at SPPORTER. So that's SP Porter at expresswithcare.com. I also have an Instagram page at Express with Care. So I post little tidbits on there, just little knowledge drops there. So those are the places you can reach me.
Awesome. Thank you. Thank you. Thank you. And I always forget about Instagram. So let me just go to Instagram and just see if there are any comments there. It looks like there are just people saying hello, 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 hello. My son joined. Yes, I was talking about you. At the beginning of the broadcast. So, and hello to everyone that joined. If you are catching the replay, make sure you let us know that you did catch the replay. Like, share, comment, share with a mom that may be breastfeeding, may be considering it, may have stopped and want to go back. Sanford just told us that you can relactate. I might go and try to make some money, Sanford. I don't know. Time's getting hard.
Girl, ain't nothing else coming out of here. I'm done.
Because I heard it's liquid gold, so you can make some good money. I'm joking, not joking. So again, thank you, and I will share Sanpree's lactation with Express with Care. I'll share her page to my stories just in case you guys are really wanting to get in contact with her because she is, your stuff, girlfriend.
Thank you.
You do, so I appreciate it. All right, you guys, I will check you next time. Bye bye.
Bye bye. Thanks for having me.
Yes, ma'am.